Hi everyone, my name is Anita Jiha. I am the lactation consultant here at Mercy Hospital. And today we're going to be talking about prenatal breastfeeding. All right, I would like to go over the 6 tools of attachment parenting. So number 1 is connect with your baby early. What does that mean, connect with your baby early? Well, as soon as the baby is born, we recommend you do what skin to skin, okay? That's the best thing for the baby because of the transition from womb to being outside. That will help the baby's temperature, that will help the baby's breathing, and also blood sugar. The question I get asked a lot is, will my baby latch? Well, every baby is different when they're born. Some babies are very sleepy, some baby latch on right away. And if the baby does not latch, is that a problem? No, it's not. Don't worry about it. Skin to skin, enjoy your baby, look at your baby, talk to your baby. Basically, that's the most. That's what they need the most right now. Okay. If they latch, great. If they don't, no worries. When they're hungry, I promise you, they will eat. Okay. Should I give formula if the baby does not latch? No, you don't. Okay. Some babies have a medical reason why they have to have formula, but if there's no reason, the nurse will tell you if there's a reason why they give formula, but usually they don't give formula and it's not necessary unless, like I said, it's a medical reason. Okay? So enjoy your baby. Don't worry so much about getting them to latch or getting them to feed. Number 2, tools of attachment parenting is read and respond to your baby's cues. Now, what does that mean, read and respond to your baby's cues? What is cues? Cues is little hints that baby gives you that they're getting ready to eat. So that could be different cues that they'll give you. Crying is a late indicator of hunger. So what do we watch for? Basically rooting, sucking on the hand very ravenously, rapid eye movement, that their increased alertness, they start looking around. You don't want to wait for the baby to cry, okay? Cues is, crying is a way of communicating. Crying does not always mean that it's food, okay? Remember, when the babies come out, it's a very stressful environment. They have to learn how to breathe, how to smell. Everything is new. So they're gonna cry, but it's not always that means it's hunger. So that's something you wanna learn about your baby. That's why spend a lot of time with your baby by, again, the skin to skin. Get to know your baby, learn to know the different cries, and you will get to know that by spending time with your baby, okay? So crying is not always an indication that the baby's hungry. So that's something you will learn eventually, okay? So read and respond to your baby's cues. That's very important. And when in doubt, always put the baby to the breast. All right, so number 3, tools of attachment parenting is wear your baby. Again, so remember your baby's used to being in the belly and you are constantly walking, moving back and forth. They're used to being held. So again, that's one thing I hear a lot. My baby will get used to being held. Well, you've carried a baby for at least 9 months, a long time, okay? So there are tools that you can use, and I do recommend that you get a sling or a baby carrier, because some babies like to be carried a lot, and then that's something you will find out. Again, every baby is different. Some don't mind if you don't carry them a lot. Some are very needy. So that's something you will learn about your baby. So I do recommend you get like a sling, a baby carrier, the Maya wrap, something that, free up your hands. If you need to do things at home and then your baby doesn't want to stay in a swing or wherever you have that baby, so that way you have your hands free, okay? So it's kind of mimic the womb, because remember, you carried your baby again for 9 long months. So they're basically already used to being held. So don't worry about that you're gonna spoil baby, okay? So they're already used to it. All right, so number 4, it talks about sleeping, how to get your baby to sleep. What I would like to see to recommend is for you to watch this. It's called Happiest Baby on the Block. And I do recommend you watch it before the baby is born, because you will need to use those tools when you're in the hospital. So what it's talking about is, what is it like in the womb? Basically, the womb is tight, there's movement, there's sounds, okay? And the baby is always probably sucking on something, their finger or anything that comes around their mouth. So what he does, he incorporated those things that are happening inside the womb into that DVD. Means swaddling. You want to swaddle your baby for them to learn how to go to sleep, okay? That's tight. The side position. So the baby, I have a baby right here, so we're gonna put the baby on its side like this, okay? When they're like that, they feel protected, so they feel safe, so they'll sleep faster. You have soothing sound. We're making the white noise, and I'm sure probably some of you already have that machine that makes the white noise. Sometimes it may work, sometimes it may not. You may have to do it yourself, which is the shushing sounds, okay? Then you have movement. Movement, okay? Baby like movement. So you constantly, when you were pregnant, you were constantly moving back and forth, so that keeps the baby calm and falling asleep, and that's what they like. And sucking. Sucking is important for a baby. It's the most powerful way to calm a baby. That's why I say when a baby cries, it's not always that they want to eat. So they kind of probably sometimes want to suckle on something. Now, because you're breastfeeding, it is recommended to delay the pacifier for at least 1 month, okay, after the baby's born. Now, why avoid pacifier for 1 month? Well, remember, the baby's sucking reflex is immature, okay? They have to learn to suck, swallow, and breathe. Also, they're gonna be losing some weight, okay? Also, pacifier causes them to suck incorrectly. So when they're gonna go on the breast, they're gonna start sucking the way they were sucking on a pacifier, which is gonna cause you pain or a shallow latch. Excuse me. So you want to avoid that. Also, it causes them to burn calories, especially if they're not breastfeeding and if they're sleeping, they have the pacifier in their mouth, they're constantly sucking. That are gonna cause them to lose more weight and burn calories. So we don't want that. So avoid the pacifier. Sometimes it may be used for certain tests when the nurse is going to be doing some tests, or the doctor. They may use it for a moment, but after that, don't use it anymore. So you want to use a single molded pacifier, okay? Means a one piece, that there's no bacteria that go in and it's round, versus the other kind of pacifier, which this one is very common. People mostly always buy this. You want to avoid this. According to the American Academy of Pediatrics, they do not recommend these pacifiers anymore. Means multi-pieces, okay? Also, the shape is a weird shape, okay? There's no nipple shape like this. Too many pieces, they could break. Bacteria can go inside the pacifier. So this is one, and then this is the other one. I believe this one is called the Nuke, which you want to avoid that one. It causes the palate, the sinus problem, extend too many pieces. So you don't want to get a multi-piece pacifier. So this one is the Nuke. So the best one is this green one, which usually the hospital will probably give you one. But again, if they give you one, don't use it yet. Wait, put it aside, which is the best one to use eventually. If you choose to use a pacifier, this is the right one, okay? Should I use a pacifier? You don't have to after 1 month. It's up to you, okay? So you don't really have to. So, but if you choose to use one, this is the good one, okay? So this is what this DVD is. So make sure, please watch it before your baby is born, because again, you will need to use those techniques at night, especially at night, because babies are naturally nocturnal, okay? During the day, I don't know, you move a lot, so it keeps them sleepy. At night, when you stop, what happens when you lay in bed at night? They start moving a lot, okay? So, very common, very normal, okay? So, that's, again, it's called Happiest Baby on the Block. I prefer you watch the DVD versus the book, but if you already have the book, great. But if you don't, then get the DVD. So now we're gonna be talking about breastfeeding. Now, one of the things also I get asked a lot, should I prepare my nipples? Basically, you don't need to do anything prenatally, okay? There's no preparation needed, no cream. Some of you may have heard you need to toughen up your nipple, means you're gonna do a toothbrush on your nipple, okay? That sounds very painful. So, no, okay? Or a nail file on your nipples. Please don't, okay? There's no preparation needed, no cream. You don't need to buy, and I know there's people who are buying lanolin. Please do not use this. I always say, if you don't eat it, you cannot put it on your nipple because your baby will be eating there. So it's not something that's natural. If you want to look up where lanolin is come from, it's from sheep wool, okay? And they use that for leather, paint. Again, it's not something you want to ingest, okay? So avoid this. You don't need this, okay? So no preparation needed for your breasts, all right? Now remember, when your baby is born, the suck swallow reflex is immature, okay? So once you become pregnant, the second trimester, you already start producing milk, okay? What you have in your breast right now is called colostrum, okay? Colostrum is very important. This is very concentrated nutrients and antibodies. Again, it's in very small quantity. Remember that. Colostrum also is high in carbohydrate, high in protein, high in antibodies, and low in fat, because newborns find it difficult to digest. Now, newborns have very small, remember, very small digestive system. Colostrum delivers nutrient in a very concentrated, low-value form, okay? It has a mild laxative effect, encouraging the passing of the baby's first stool, which is called the meconium, okay? So the meconium is gonna be the first poop that the baby's gonna give you. It's gonna be black, okay? It's called the meconium. Colostrum, again, contain large amount of antibodies called IgA that protects the mucous membrane in the throat, lungs, and intestine of the infant. Ingesting colostrum establishes beneficial bacteria in the digestive tract. Now, as you heard me mention, newborn has very small digestive system. That's why colostrum is very concentrated, okay? They don't need volume. Why? Because if you see, I'm gonna show you the size of the baby's stomach at day 1 and 2. It's a very tiny little ball, the red ball right here. It's a very small. They don't need a lot of food. So that's why colostrum, at first, it's in small quantity, because it's like, I always say colostrum is like condensed milk. Okay, it's very rich, it's very thick. So they don't need a lot. A few mLs, 3 to 5 mLs, that's all they need. Because how much can you put in this little stomach? It won't hold a lot. And then what happens if you give them too much food? What happens is they vomit. So we don't want to do that to those little guys. Now, remember, you make enough milk for your baby. Most first-time mom makes about 37 mLs, which is a little over an ounce in 24 hours. So now remember, you have to feed your baby somewhere around 8 to 12 times a day. Yes, you have to wake your baby up every 2 hours. But people say, well, he's sleeping. Do I have to wake him up? Yes, you do. Remember, the more you pick up your baby, the more you get to know your baby, the more you learn how to handle your baby. Because a lot of moms seem to be afraid of the baby. They think they're very fragile. But they're not. They're very strong. So it's important that you pick up that baby and wake him up every 2 hours during the day. Excuse me. And at least 4 hours at night. You can let them go a little longer at night if they do. If they don't, you still have to offer the breast, okay? So by day 5, you'll be producing 500 mLs. Basically, how do you go from 37 mLs to 500 mLs in 5 days? Nursing, okay? What makes milk? Baby, all right? People ask me, well, what can I drink or eat to make milk? Unfortunately, again, I know there's a lot of myth out there. Every culture has something that they say makes milk. You have Malta with condensed milk. You have horchata, you have teas, you have, again, those are not gonna hurt, but you have to put your baby to the breast in order to make milk, okay? So the more you nurse, the more you make. It's called supply and demand, okay? So now the question I get asked, how do you know baby's eating? Because you cannot see the amount that the baby's eating. Well, there's a few things you could look for. One is output, okay? The first day your baby has to have one pee-pee. Remember, when I talk about day is 24 hours. So in a 24-hour period, so the first 24-hour baby should have one pee-pee and 1 to 2 poop, and it's gonna be black. The second 24 hours means the baby's gonna go under 48 hours, so that means 2 pee-pee, minimum, okay? And 2 to 3 poops. Those are gonna be also black. By day 3 pee-pee and 2 to 3 poops. Now by day 3, the stool is gonna change a little bit, okay? It's gonna be brown greenish. Day 4 pee. Remember, those are minimum. More is always better, okay? So the more poop they do, great. The more pee they do, awesome, okay? And day 4, the stool should be brown yellow, okay? You will get a handout. If you're giving birth at Mercy, you could get it out in the hospital just to keep track, and it looks like this. It's a track where you're gonna keep tracking of your baby's pee and poop, so that way the nurse can note it, okay? So it's very important that you keep track of the baby's output, okay? So that's one indication that the baby is gonna be eating. So when you go to your pediatrician, your baby's gonna gain weight, the baby satisfies after feeding, not always sleepy, okay? Babies are very sleepy, mostly at the beginning, on the first few days of life, okay? So this is one way of knowing the baby's eating, okay? The other way is that when the baby's on the breast, you basically want to unwrap your baby, okay? When they give you a baby, the baby's gonna be swaddled with many, many blankets, hats, and booties, and everything. Basically, before you feed, you wanna take everything off, okay? What people say, well, is that the baby's gonna get cold. No, because remember, when you do skin to skin, you are transferring heat to the baby. So skin to skin is important. So make sure you unwrap your baby. Do not keep them swaddled because they will fall asleep on the breast. So one thing I'm gonna go over, I'm gonna also recommend a breastfeeding pillow. One of my favorite is, I don't know if you already have it, some of you may have the Bobby, but it's called My Breast Friend, okay? I highly recommend you get that. You may not be able to use it the first day, especially if you had a C-section. It might interfere with your incision, or you start using it the next day. But it's a great tool to have. That's basically one of the things I recommend for breastfeeding. You don't need to bring your breast pump. People say, well, should I bring my breast pump? You don't need to. This is gonna be your pump right here. If for some reason your baby goes to the NICU, then you will get a pump, and we'll give it to you here in the hospital for use in the hospital, okay? So you don't have to worry about bringing your breast pump because you won't need it, okay? The only thing you might need to bring that's good is a breastfeeding pillow. Basically, that's all you need for breastfeeding, for the hospital, okay? So I like this pillow. See how you can see? It's nice and firm, okay? And you don't want to put it a high like this. Some people will put it here, the baby's right here. So basically, you want to kind of have it on your waist. And then when you're sitting down, if your belly bothers you, you can put a pillow underneath that. So when you push down, it doesn't bother your incision, okay? So I like to show a little bit about positioning. Basically, when you wake your baby up every 2 hours during the day, remember? And I only like those two positions for the first few weeks of life. Eventually, once you get used to it, you get a better handle on the baby, then you can, different position is fine. As long as you are not sore, okay? What causes sore nipples is, again, the technique that you use to get the baby to latch. So one of the technique I like, position I like is the cross cradle. So which is the babies, you have to turn the baby tummy to tummy, okay? You cannot leave the baby on his back and have the baby turn his head to look for the nipple. Basically, you're blocking the baby's airway. So the baby won't be able to eat that way. So you have to turn the baby to face you in order to get the baby to latch correctly. So you're gonna have the baby in front of the breast. You're gonna hold the breast with the other hand. You probably wonder what you do with the other hand. You hold the breast, you hold the baby's head, and basically you wait for the baby to open. You bring the baby to the breast, okay? That's the cross cradle position. So you hold the baby nice and secure. The pillow is to help your arm. It's not for the baby to lay on it and then you're going over the baby like this. No, okay? You want to keep the baby tummy to tummy, grab the head, hold the breast, and you get the baby on. Okay, that's the cross cradle. Now the other position I like is the football. Means, as you can see, you can turn the pillow sideways for the football. Have the baby's tummy to its side, okay? Same thing, you're gonna hold the baby's head, you're gonna hold the breast with the other hand, and then you're gonna bring the baby to your breast, okay? That's the other position I recommend, which is the football, okay? So the baby's on his side, okay? Now, how do you know baby's eating? So you wanna make sure you watch for suck, swallow. So every time the baby sucks, there should be a swallow, okay? It's a rhythmic, it's long, slow rhythm that you're looking for when the baby's eating, okay? And that's how you know baby is actually eating when he's on the breast, okay? So remember, the baby will not eat a lot the first couple of days because their stomach is very small, okay? You may say, well, I don't feel milk. Yeah, you're not gonna feel your breasts are gonna be the same when you give birth. You're only gonna start seeing fullness after 3 to 5 days. You're gonna start feeling your breast full. In order to prevent what's called engorgement, means your breasts are hard like a rock, is to feed often. The more often you feed, you're gonna avoid that problem because it's very painful. If you get to a point where your breasts are really hard, sometimes hard for the baby to attach because the breast is too hard, so it makes it difficult. So the more often you feed, the less engorgement you have. Now, by day 3, what happens? People ask again, that's one of the questions I guess asked, when will my milk come in? Well, in 3 to 5 days, you will start producing more, okay? Now, remember the first 2 days is the size of the baby's stomach. They don't need a lot of milk. It can hold too much. If they get too much milk, they'll vomit. Now, the 3rd day, you'll start producing more. This is the size of the baby's stomach, okay? So slightly larger. And this is around day 10, okay? And then you will produce enough when the time comes, okay? So the first 2 days is very important that you understand the baby's stomach size is very small, so they do not need a lot of milk. And that's one thing I like to emphasize a lot on because people tend to think that baby needs a lot of milk. No, they don't because they have a very small stomach, okay? And also babies are full of fluids when they're born. Sometimes they don't want to eat. So if you try every 2 hours, they don't want to eat, it's okay as long as you're trying because they're full of fluids from the birth, means amniotic fluid. They'll start speeding up, okay? So when you saw that, they probably won't eat. Just do skin to skin and then try again a little bit later, like in an hour or so, okay? And they will eventually latch on, like I said, when they're hungry. But it's gonna be a lot of attempts, okay, to try to nurse. So let's do a quick review. Now you wanna make sure you wake your baby up every 2 hours during the day and 4 hours at night. Remember, the baby may not always latch every 2 hours. Like I said, do I have to give formula if the baby doesn't latch? Not necessarily. Unless, like I said at the beginning, is a medical reason, okay? So 2 hours during the day, 4 hours at night. Next is also keep track of your baby's output, very important. The nurse will be asking you to let her know how many pee and poop each time. If you breastfed, okay? Remember, crying is not always food. Crying is babies communicating a need with you. you need to find out what it is and how you, like I said, how you will find out is the more time you spend with your baby. Again, the more you get to know your baby. Okay. Is breastfeeding painful? No, you shouldn't feel any pain. You will feel a discomfort. I mean, you feel a tugging. Again, no cracking, bleeding, no. Okay. Some tenderness is normal. Now, what can you put in on your nipple if you get some soreness? Again, like I said, I do not recommend you use lanolin. You can use your breast milk, express a little bit after the feeding to express on your nipple. You could use a little olive oil, a little coconut oil, okay? That's what I would recommend because those things you can ingest, okay? How do you know baby's eating? Again, you're gonna be getting the weight when you go to the pediatrician for the follow-up. You're also gonna see your baby's calm when they eat, their hands are relaxed, okay? So those are how you know your baby's getting enough. Now, pumping, when do you start pumping? Pumping starts at 4 weeks. Like I said, if your baby's in the NICU, you may start to pump before the 4 weeks. But just a quick thing is on pumping is 4 weeks, okay? Remember, pumping is not the same as the baby. The pump removes less than what the baby does, okay? Baby is a better pump than the machine. But we do recommend you start pumping, especially if you're going to go back to work or you want to start storing. So basically the pumping starts at 4 weeks. That's one of the questions everybody gets asked every day when they have the baby. So 4 weeks. Bottle, when do you introduce the bottle? 6 weeks, okay? So 4 weeks to pump, and at 6 weeks, you start introducing 1 bottle a day, okay? So that's what I would, that's the recommendation so you can be successful at breastfeeding. And then the reason why you're starting the bottle later is just you don't want the baby to get used to the bottle because, you know, they're very smart. People says, well, will he get, he's confused. No, babies are never confused. They're very smart. The bottle is so much easier. Remember, the breast is more work for them than the bottle. So they get the bottle too early on when they're born, then they get used to it and they prefer the bottle, okay? So that's why we recommend not to use the bottle until after 6 weeks. Pacifier, again, recap, 1 pound over birth weight, which is 4 weeks. You want to delay it to avoid the losing weight, the sucking incorrectly, and all that. The number 6 tools of attachment parenting is trust your instinct. I like this quote. It says, the baby has only 3 demands. They are the mother's breast, the warmth from her body, and the knowledge and security of her presence. Breastfeeding satisfies all 3, okay? So if you have any questions, please do not hesitate to call me. Maybe reach here at Mercy Hospital. My number is 305-446-2229. Any questions, please feel free to give me a call. I hope you enjoyed the class. Hopefully I get to meet you all soon. In the meantime, please, again, you have a little homework to do. Don't forget the DVD to watch. And then I'll see you soon. I wish you all the best. Thank you.